This video illustrates the usage of Healthnet System in brief, in that, the end users of this system are the patients, whereas the healthcare centers are the service providers. They are called the Healthnet service providers. In this play we have 7 characters who are getting healthcare or providing healthcare through this Healthnet system, and they are Alice, who has the responsibility of bringing out 4 children. Bob is from the guest family of Alice, and he is visually challenged. Lisa from the same guest family and having fever for 1 month. Dr. Joe, a doctor at the clinic near to Alice's house. Tom, the supervisor of Bob in his navigation, who was recently diagnosed of cancer stomach. Dr. Jim, consultant of Tom in treating him from cancer. Dr. Julie, laboratory results reporting doctor. Okay, let us see how their healthcare journey happening through Healthnet system.
On a shiny day, while Alice was preparing meals for her 4 children, her friend Lisa has visited her house with a surprise. Lisa's husband, Bob, is a visually challenged person, and he is under the supervision of Personal Navigation Assisting subsystem of Healthnet System. Thus, his personal navigations are supervised by Tom, who is working in a care center for visually challenged, near to Alice's house, and they were on the way for meeting Bob's supervisor, Tom, as he was diagnosed as cancer stomach and on treatment by LOT devices of Molecular Dynamic Synchronized Manipulator subsystem of instrumentations of Healthnet system. Concurrently, Liza also having fever for 2 weeks while she was traveling. As she already had treatment for typhoid fever 3 months before, through Healthnet system, she wished to find out from Lisa that any clinic near to her residence is providing Healthnet services. On responding to her query, Alice responded that there is a small clinic 1 kilometer from her house is providing Healthnet services. She also verified with Lisa whether she already using Healthnet system by registering in it, and it's so her previous medical history can be accessed from this clinic itself. Or else also she can register as a new patient in this system from this clinic itself, she added. She further insisted her wish to accompany with them to that clinic, as she also has to change the leads of the LOT-enabled cardio monitor being installed with her.
Before they had reached the consultation room of Dr. Joe, the Healthnet system sensed their presence in the clinic by GPS and their records downloaded, then analyzed. Thus, on seeing Alice, Dr. Joe declared that the cardiac parameters of Alice is okay. But he insisted to change one of the leads in the monitor that had been installed with her earlier. Alice accepted Dr. Joe's advice to change the lead without any hesitation, as she has to visit her uncle's house tomorrow that is about 100 kilometers from there. But she expressed her anxiety for getting cardiac care at her uncle's house if any emergency arises. The answer she received from Dr. Joe was very cool. Dr. Joe explained to Alice that if any abnormality in her real-time cardiac data, she will be picked up by a fully equipped cardiac emergency ambulance instructed by Healthnet system to the nearest big hospital. Having Healthnet system, and thus she need not be tense to stay in her uncle's house. Alice expressed her thanks to Dr. Joe for detailing the healthcare benefits she receives by Healthnet system. Then Alice introduced her guest Lisa to Dr. Joe for consultancy, and they started interacting.
By automatic utilization of patient's deployment subsystem of Healthnet system, Dr. Joe's computer system was prompted up with the latest medical history of Lisa. Thus, on facial recognition of Liza, Dr. Joe confirmed Liza's medical history by asking Lisa whether she is having fever for 2 weeks and was diagnosed of having typhoid fever 3 months before. After completing the Healthnet system guided clinical evaluation with Lisa, Dr. Joe recommended some lab tests for Lisa. But Lisa explained her difficulties in performing the lab tests as the next event order, as her husband has to meet his supervisor urgently. Thus she requested the Dr. Joe for a temporary treatment measures till she complete her lab tests after her husband's meeting with his supervisor.
On seeing the prompted up record of Bob, Dr. Joe liked to help Bob as he is visually challenged. Thus, in correlating with Bob's and Lisa's previous statements, Dr. Joe decided to accompany Bob to have the consensus of his supervisor to access his current health status for planning his navigations and alternatives. In view of previous transient constraints Bob had in availing his navigation assistance services while his supervisor was sick, he felt much thankful to receive this guidance from Dr. Joe, and they proceeded towards the caretaker institution for visually challenged, called Sound Vision, where Bob's supervisor Tom is working. On reaching Sound Vision, Dr. Joe found that Dr. Jim is the consultant for Tom in treating his illness on cancer stomach. Thus Dr. Joe explained Dr. Jim for the urgent requirement of Bob for his uninterrupted assistance required from Sound Vision as he is on travel. Further, Dr. Joe requested with Dr. Jim for getting consensus from one of his current client, Tom, for accessing his current health status by his visually challenged client, Bob. Subsequently, Dr. Jim requested Tom to provide his consensus to access his health status, and eventually, Tom sanctioned that for Bob. As Tom's health status indicates that he is rapidly getting cured, Bob decided to proceed with further navigations without any restraints.
After confirming the supervisor status of Bob, Lisa proceeded with her lab tests, and within the lab itself her diagnosis was confirmed as typhoid fever relapse. Then, real-time treatment schedule was established with Lisa by installing IAT thermometer with reading schedule for graph and emergency reading options. Also provided with drug regime monitoring and events recorder IAT device. Dietitian will be informed to deliver specific diet at her location in scheduled timings. Rule-based operational decisions are confirmed by Dr. Joe. Deliver sensitive antibiotics with regime at her location after getting the drug sensitivity report from lab. Also, real-time decision support for rule-based admission recommendation and undertaking is set on by Dr. Joe.
Thank you for your interest in Healthnet System. With this we have reached our Healthnet healthcare journey at this station, and we shall continue our journey in our next video upgrade. Have a healthy day. All characters of this play are fiction only and not representing any individual.